Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, one of the deadliest syndromes you've never heard about. Break and number 148, it's one of the deadliest syndromes you've never heard of, but experts are hoping to change that. Break nearly 9 of 10 Americans have not heard of cardiovascular kidney metabolic, CKM, syndrome, even though about the same proportion are affected by it, according to a new survey by the American Heart Association, AHA. CKM syndrome represents a cluster of health problems occurring in one of the body's most essential and number 156, full circle systems, and number 157, experts said. It includes heart disease, kidney disease, diabetes and obesity. And number 156, the heart, kidney and metabolic systems are connected and, as such, should be treated in a coordinated way, and number 157, Dr. Eduardo Sanchez, the AHA's chief medical officer for prevention, said in a news release. These results reveal the need to emphasize those connections and help patients understand the importance of collaborative care. And number 157. Nearly 90% of U.S. adults have at least one risk factor for CKM, which was defined by the AHA in 2023. These risk factors include high blood pressure, abnormal cholesterol, high blood sugar, excess weight and reduced kidney function, the AHA says. The interplay of these factors can increase a person's risk of heart attack, stroke and heart failure more than any one of them alone. CKM syndrome affect the complex system that fuels the body. The heart pumps blood throughout the body. The metabolic system burns blood sugar for energy. Waste from blood sugar metabolism dumps back into the blood. The kidneys filter that waste and balance fluids, which helps with blood pressure. Blood pressure affects how the heart pumps blood. And number 156, it's a foo less than /speak. Speak LL circle, and number 157, Sanchez said. And number 156, you can take care of your overall health with regular checks of your blood pressure, cholesterol, weight, blood sugar and kidney function. And number 157. For most people, CKM syndrome is reversible with medication and changes to their lifestyle like eating healthier and getting more exercise, experts said. But word hasn't yet gotten out about CKM syndrome, as the new survey found that only 12% of US adults have heard of it. There also were some powerful misperceptions associated with the syndrome. For example, 42% of those surveyed believed that a healthy heart wouldn't likely be damaged by illnesses affecting other organ systems, or they weren't sure. And 68% incorrectly believed that it's best to manage individual conditions one at a time, or weren't sure of the best way to manage them. However, people also seemed interested in learning more about CKM syndrome. 4 in 5, 79%, said it's important to understand CKM health, and 72% said they're interested in learning more about it. Most were interested in learning how CKM syndrome is treated, 72%, and diagnosed, 71%. And number 156, we want people to know that it's really common to have heart, kidney and metabolic risk factors at the same time, and number 157, Sanchez said. And number 156, it is reassuring that once the CKM connection was defined, nearly 3/4 of those responding understood that it was important and wanted to learn more. And number 157. The AHA plans to issue its first ever guidelines on CKM syndrome in early 2026. The online survey was conducted in August 2025 among 4,007 adults. The margin of error is plus or minus 2 percentage points. Sources: American Heart Association, news release, October 28, 2025. Break disclaimer: statistical data in medical articles provide general trends and do not pertain to individuals. Individual factors can vary greatly. Always seek personalized medical advice for individual healthcare decisions. Break and copy, 2025 Health Day. All rights reserved. Break ad as a preferred source on Google. Read this next: skinny fat contributes to heart attack, stroke less than /speak risk. Break and number 148, hidden deposits of fat deep inside the abdomen and liver can quietly increase your risk of stroke and heart attack, even if you appear to have a. Break GLP-1 drugs, such as Ozempic, Zepbound, help protect against sleep apnea, study says. Break and number 148, weight loss drugs like Ozempic and Zepbound might help protect people from health risks related to sleep apnea, a new study says. Type 2 diabetes. Break AI counts kids' bites in fight against obesity. Break and number 148, a new AI-driven bite counter is in development to help counter childhood obesity. And number 147, potentially even tracking kids while they eat and urging. Break more news resources to MedWatch. Drug alerts daily. Med news for health professionals. New drug approvals, new drug applications, drug shortages, clinical trial results, generic drug approvals. Subscribe to our newsletter. Break whatever your topic of interest. Subscribe to our newsletters to get the best of drugs.com in your inbox. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.